Welcome back to The Explainer. Today we're doing something a little different. We're going to treat your sinus congestion exactly how a clinical physical therapist treats a stiff joint. We are talking about mechanical decompression for sinus relief.
So let's do a really quick self-assessment right now. Take a deep breath. I mean it. Do it with me. Is one side of your nose stubbornly blocked? Do you feel that heavy, annoying pressure right behind your eyes, maybe across your forehead or cheeks? You know the drill. You lay down at night, one side completely shuts down, you roll over, and it instantly shifts to the other side. Or you just wake up feeling incredibly heavy in your face.
Well, if that sounds familiar, or if you're feeling blocked right now, seriously, put down the nasal spray for just a second. I want you to stay with me for the next 30 seconds because we're going to try an immediate, natural mechanical fix that might open things up real fast.
Okay, let's dive into the actual biomechanics of why you get stuffed up. Section 1. Anatomy of restricted drainage, the structural cause of congestion.
As a physical therapist, I like to look at the body as one giant, interconnected mechanical system. Most people don't realize that your sinuses don't just magically get blocked. They literally lose their physical ability to drain. You've got four main sinus cavities: the frontal, right above your eyebrows, the ethmoid sitting between your eyes, the maxillary deep in your cheeks, and the sphenoid way back behind the nasal cavity. Now these are lined with mucous membranes and tiny little hair-like sweepers called cilia. Normally, they just constantly push fluid through these incredibly narrow drainage pathways.
But here's where the whole structural system gets thrown out of whack. Those openings are extremely narrow to begin with. When inflammation hits, maybe from a cold, a virus, or those pesky seasonal allergies, the soft tissue around those pathways actually swells up. And when it swells, it physically clamps down on those tiny drainage pipes. Like, imagine kinking a garden hose. Fluid builds up, pressure goes through the roof, and bam, your airflow is completely restricted.
Which brings us to a really fascinating comparison. Most of us just reach for chemical sprays or decongestants, right? And sure, they give you some temporary relief, but think about it from a structural perspective. If the physical tissues around those pathways are still clamped completely shut, the pressure is just going to come right back the second that medicine wears off. Mechanical decompression, though, that actually physically opens those tissues to restore your body's natural plumbing system.
Moving right along, let's look at exactly what we are manipulating here. Section 2. Fascia and sinus pressure. Connective tissues role in congestion.
So here's a crazy piece of anatomy for you. Your facial connective tissue, your fascia, can actually act like a super tight physical cage, trapping all that sinus fluid. Consider the glabella. That's the anatomical sweet spot located directly between your eyebrows. There are crucial connective tissue relationships right around the bridge of your nose and this glabella area. When these tissues get tight and restricted, they actively contribute to that heavy, congested feeling you're experiencing.
So how do we fix a physical restriction? Well, with physical intervention. By applying gentle opposing forces right to this specific region, we can create a really subtle decompression. We are literally manually stretching those restricted tissues to unkink the hose, so to speak, letting those tiny sinus pathways open back up and function normally again.
All right, let's turn this theory into an actionable routine you can use right now. Section 3, the mechanical traction technique, your guided clinical protocol.
Okay, I want you to literally follow these exact steps with me. First, take the heel of your hand, either hand works, and press it right into that glabella, directly between the eyebrows. Push inward firmly, and then slide the tissue just slightly upwards. Got it? Okay, now take two fingers from your other hand and firmly pinch the very top of the bridge of your nose. Squeeze and pull straight down. So you've got one force pushing in and up and the other pulling down, creating traction. Just hold this stretch for about 30 to 60 seconds and start breathing slowly through your nose. Don't force it. Just let your body respond to the mechanical release. Now you might feel a little silly holding your face like this, but you're not just rubbing your skin here. You're applying a targeted clinical technique. This subtle decompression mechanically separates the fascial tissue connected to your ethmoid and frontal regions. You are unpinching those blocked anatomical structures and physically taking the structural pressure right off those pipes.
But we can actually take this one step further to maximize that drainage. Section 4, altering the pressure gradient, the advanced addition. So while you are holding that exact same traction, pushing in and up at the glabella, pulling down on the nasal bridge, I want you to slowly lift your chin upwards toward the ceiling. Hold your head tilted back like that for about 5 seconds. Then slowly bring your chin back down to a neutral position. Go ahead and try that a few times while maintaining the stretch. Up for 5 seconds and right back down. This part is just so cool. because it brilliantly illustrates how our bodies work with physics. By tilting your head back while mechanically holding the airways open, that simple chin lift alters the gravitational pressure gradient inside your sinus cavities. We open the pathways manually with traction, and now we are using literal gravity and pressure changes to force that trapped fluid to physically shift and drain right out.
Okay, wrap-up time. Let's talk about implementation. Section 5, clinical safety and maintenance, when to use this technique.
For a lot of people, doing this just one time provides an immediate noticeable release. You'll literally feel the airflow opening up or the pressure easing away right on the spot. And because this technique works entirely with your body's biomechanical structure, not fighting against it with chemicals, it's incredibly safe. You can easily do this several times a day. It is the perfect, absolutely free tool to keep in your back pocket whenever that heavy, annoying, blocked feeling sets into your face.
Now, quick caveat on clinical safety here. We have to know the limits of physical therapy. If you're dealing with severe facial pain, a high fever, chronic sinus infections, or symptoms that just aren't budging no matter what you do, you need to step away from the home structural remedies. That is definitely the time to get a medical physician or an ENT specialist to properly evaluate what's going on. But for your standard run-of-the-mill congestion, this is an absolute game changer. So check back in with your breathing right now. Did your airflow instantly improve? Did that pressure ease up even a little bit? I mean, it is pretty incredible that by simply understanding and manipulating your body's mechanics, you have the physical power to structurally clear your own airways. Try it again tonight when you lay down in bed. And honestly, it kind of leaves you wondering, how many of our other everyday elements are actually structural problems masquerading as chemical ones?